Thanks, Colin. Whakalofa lahi atu, and thank you, Honourable Minister, for the opening. I understand it's recorded, but it was a really important opening session, and I think it frames this evening's conversation, talanoa, really nicely. I'm just going to share some slides. If they come up, let me know. And how's that, everyone? Is that good?
Yes.
Yep.
Okay, so look, I've under strict instructions from Sir Colin to be very brief, which is quite a challenge for me, as Colin and others know, because I do love to talk, but particularly I feel really passionate about, and I feel really honoured to be invited to talk a little bit, 15 minutes, about why Niuean health workers, clinicians, community workers, people involved in Niue society broadly should be involved in research. And I just want to open up by saying, just as Colin mentions, this is about health, but actually I first came to research not originally from a health background. My background is in social sciences. I did a sociology degree. And I was just really interested in it. And actually, I didn't start my degree till I was perhaps a little bit older than my contemporaries. But I was just really interested in people. And I was interested in the way they think and the way they make decisions about their behaviours. So on that basis, I just, whoops, am I going to? So I really want to focus on why it's incredibly important that everyone has a chance to participate in research. I think it's often positioned as something really special, like only academics or scientists can do it. It requires a whole set of very, very specialized skills that take many years to cultivate. But that's actually not the case. Everyone can get involved. And I think what is most important, the message from the opening session, was it is particularly important for people who, for research questions to be generated from within the context. So essentially what I mean by that is that research undertaken by clinicians or nurses, healthcare workers, absolutely makes a difference. And it's far more likely to be relevant and meaningful and have an impact than a research question perhaps generated by a curious outsider, somebody who is curious about how things roll in Niue, doesn't have no value, but it doesn't bring the integrity and the value that research questions that are generated from being in the environment and knowing what matters to your people, your communities. You know your people best. And I think that's number one. So context is incredibly important. I remember once being involved in a piece of research. I had to jump onto a project that was halfway through. Somebody had to take some leave, and I was asked to participate in a research project about drowning, essentially about people's perceptions of risk of drowning. And I, at that point, didn't know how to swim, which is interesting because I now love swimming, and I didn't know anything about drowning behaviour or anything like that. But what was most relevant, I think, for my involvement in this research was that I was incredibly interested and curious about why people do the things they do when they go into seawater, into the oceans and the beaches around Auckland. So you don't have to be an expert in the topic. You have to have a curiosity, most of all. The thing also that's really important is that you're the most closest to your patients, your friends, and your family. And that's where the most, I think, interesting and important priority research questions come from. So we don't just look at academic articles. We don't just read scientific reports to generate questions. We generate research questions by actually reflecting on our clinical practice, by listening to the conversations that are going around our dinner table and asking, why are people thinking like that? Why are they behaving like that? What is driving it? Why are patients not turning up, etc.? So those are the kind of instigators to research questions. It's not actually that scientific in that way. It's actually about a curiosity. And in particular, as I say, Niuean-led research is particularly important. It has a unique value and impact. It speaks to what is most needed and is what's most interesting and relevant for the Niuean context. So that's in terms of why Niuean-led research is particularly important. Another point I want to make is research, I think, is an incredibly creative, enjoyable. It's hard going sometimes because it can take some time to execute, but it's the most productive and incredibly enjoyable when undertaken as a team. So one thing, when we hopefully conduct future sessions, we can talk about the value of and what you bring when you undertake a research question as a team, because everyone contributes something quite distinctive. But essentially, research is around coming up with or thinking about a question and then designing, and we'll talk about that in a moment, but it takes time, it takes motivation, it takes delegation, and it takes different perspectives. So who needs to get involved in research? And I, again, come back to the point that actually the most interesting research groups that I've worked with are people or groups that bring different perspectives from around a particular question. But essentially, the most important reason why we need research and why Niue needs research, and particularly research led by local healthcare workers, people working in various sectors of Niue government and social society, is that it can lead to improved patient outcomes. Essentially, that's the main reason why, and particularly in health research, we're interested in undertaking it. We like doing research because we learn new things, we understand things from a different perspective. But I think in an environment where time and resources are scarce, having a really clear purpose for your research, and mostly that's around improving patient outcomes, is a really good starting point. So research the value, again, it helps us really focus where we put our efforts, how we can improve a patient experience, how we can use those resources really carefully. For example, if we draw upon an existing collection of really routinely collected data and understand just by describing what's going on in that data, so who's turning up to clinic, who's not turning up to clinic, how can we kind of generate a bit of a profile of people who are not turning up to clinic, we're better off in terms of how we target our resources to perhaps engage with that group, figure out what is going on with them as to why they're not, or their HbA1c levels are lower or higher, for example. So again, it helps us use our resources really carefully and make sure that we, again, continually improve the services that we're providing. Briefly about funding. Funding is always, you often think about research and in the same breath you always talk about funding. I think the fantastic thing about research in this current environment that we're moving into is that we've got such rich data that is just sitting in files, essentially, on our computers. And if we become more systematic and more thorough in how we collect clinical data that we routinely collect anyway, that is the basis of your research. That can be used then to answer really important questions to improve patient care. Because applying for research funding, always possible, always encouraged, and indeed collaborations are often very successful, or can be successful, in getting funding from external agencies, but typically it's pretty scarce. So using existing or secondary or routinely collected data is something that we are going to perhaps focus a little bit more on in later sessions. So basically, what are the priorities? And I think, for improving health and well-being in Niue, or what questions come to mind when you reflect on your practice? So that's kind of how we start. And as I said earlier, it's not so much, again, you've gone and done some study and you spent hours in a library figuring out your research question. Your research questions are what you see when you walk into the clinic, or what you hear when you're having a meal with your family or sitting down with your children. For example, I mean, these are research questions that can come to mind. What is the prevalence of depression, anxiety amongst Niuean adults living in Niue? And And that is a piece of work that will be, and our PhD student will be working on later this year. So these are really important questions. We need to know what the prevalence of depression and anxiety is in order to be able to generate and orient services to meet that need. We also got some work underway here in New Zealand looking at how young people think about and what they know about infectious diseases. Again, really quite a simple piece of research, not simple to execute, but the question is really quite straightforward. How do young people think about, what do they know? What do they know about the symptoms? What are the types of behaviors that they do when they think they might have something like an infectious disease or a skin infection or otherwise? We need to know that because it's really important in order to reshape how we respond. Again, other research questions. These are things that have direct impact on changing behaviors or changing and shifting how we respond to particular health challenges. So again, I guess the point I'm trying to make is really, really simple questions that are really important. And if you note that I'm talking about a research question now, I'm not even talking about the study design and how you collect the data and analyze it. All of that flows from a question, and the question has to come from the context, has to make sense, has to be meaningful, has to be relevant, and ideally has to then be able to be translated into, and we will talk about that at another session, how do you actually answer that question? And this is just the most simple, linear, and of course we know that nothing is perfectly sequential in life like this, or not many things, but this is what I often think about. And we often have an idea, like a curiosity. I mean, I'm really interested in young people, how they think and how they behave and how they respond to particularly social media and popular culture imagery. That's something that I've always been kind of curious about. And I formulate an idea, and I might do a bit of a review of what others have written about this topic. And on that basis, I start to formulate my research question. And in this case, it could be, you know, how do young people interpret or make sense of smoking imagery in film, as my very original project many years ago, or how do young people think about infectious diseases? What do they know? Only at that point do you start to think about how you might design the study. And when I mean design, I'm meaning, do you do interviews? Do you do talanoa? Do you do a survey? Do we just analyze documents in order to answer that question? And then we go through the remainder of those stages of collecting the data, analyzing it, and writing it up. So that's your kind of really basic research process that pretty much most projects, one way or another, go through. But what we're really focusing on today is just having that curiosity and thinking about your environment and your clinical environment with a curious mind, and knowing that you know your patients and your population and your community better than anyone, despite how much money they bring with them, how much expertise they might have in research. You are best placed to make those and think about those research questions. So really briefly, and I hope I'm in time, Colin, ding a bell if I'm not, but I basically can't speak highly enough of the importance of building those skills over time, forming teams to conduct research that ensures that your community benefits from that research directly. It is not research findings that is taken away from Niue and used for other populations. It's not just for publication. It's not just for kudos. It's actually about directly relevant solutions and improvements to your community. Research led by Niueans in Niue or in Niueans here in New Zealand can have regional and global impact. So this is, again, really important. It's not just to benefit directly your community, which is number one, the priority, but there's lots of lessons learned from how did you change things that other populations have really struggled to change or make improvements with. What was different about what you did and with your population to shift behaviors? That's really interesting and really valuable. And that's why we encourage people to write. It's not just to tick the box for an academic. It's actually because we need other people to learn when things go well, but also when research doesn't go well. I really, again, find people you really like working with, work in small, ideally multidisciplinary teams. That's really satisfying. It means that you come together, you share ideas, and you're feeling like you're part of a group. You're not on your own. Research is complex. It can have some frustrating moments when things don't go perfectly smoothly, and there's nothing like an awesome team around you to keep that motivation up. Again, keep reiterating the point about asking relevant, practical questions. Keep the questions small. Sometimes I often find that people try and solve an entire huge problem, but actually you just want to take a piece of a problem and understand that first, and then you can build on it as you go further into the area. And again, the study design, how it's conducted, is driven by the research question, thinking about how much time you've got. Again, everyone's really busy, how much resources you've got at hand, whether you've got funding, whether you've got actually no funding, you just got to take down data that you've got on your in your database. And to me, they're really important. So it has to be really practical. There's nothing more frustrating than taking off more than you can manage, or anyone can manage, and not seeing it through to the end. So really small, realistic projects are the most satisfying and can have the biggest impact, and typically don't cost as much. Away.